In this program, we're going to investigate the anatomy of the human heart. We'll consider all of these structures listed on page 65 and 66 of your lab manual. Before we introduce you to actual heart specimens, it might be a good idea to take a kind of walk through an anatomical model such as this, accurate in detail and in size. It's common knowledge that the human heart is about the size of your fist, and so this represents the anterior view of a human heart. We need to understand how blood flows to, through, and away from the heart. So let's establish some references and walk ourselves through. Here on the anterior surface, we see, coming from above, a large vessel indicated in blue. This is the superior vena cava, which empties into the right atrium. But the atrium is visible externally only as this flap of cardiac tissue resembling a dog's ear. Externally, then, this is called the auricle, in this case, the right auricle. Now, coming from below and entering the right atrium as well is the inferior vena cava. So, to quickly review, blood returns from the upper body through the superior vena cava and returns from the lower body through the inferior vena cava. Let's detach the chambers. And now with the heart sectioned somewhat, we can see better the interior of the right atrium. There's a valve here which separates and controls blood flow from the right atrium to the right ventricle. This valve, you know, is the tricuspid valve. Then when the right ventricle contracts, this valve shuts and forces blood into this valve, which is the gateway into the pulmonary artery. This valve is one of two semilunar valves. This one called the pulmonary semilunar valve. Notice the three leaflets which are shown closed in this case. So blood journeys through and into the pulmonary artery, shown blue because the blood's condition at this time is deoxygenated, and therefore we see it as slightly blue. Blood returns to the heart oxygenated, and it does so through four veins seen on the back side of the heart. These are the pulmonary veins. They're shown red because the blood is now bright red, having been oxygenated in the lungs. All four pulmonary veins empty into this chamber, seen internally. This is the left atrium. When the atrium contracts, blood is forced through this open valve. This valve, an atrioventricular valve known as the bicuspid, because it has two leaflets, but more commonly referred to as the mitral valve because of its resemblance to a mitre, which is a headdress worn by Catholic clergy. This valve, as we see here on the tricuspid, has these strings or cords which attach to internal projections of the myocardium. These cords are called chordae tendineae, which restrain or hold in place the leaflets of the valve itself and prevent those leaflets from moving upward and allowing blood backward into the left atrium. This then is the left ventricle, and when this contracts, blood cannot move backwards into the left atrium, so it's moved instead and pushed through this valve, which is the gateway to the aorta. It's a semilunar valve called the aortic semilunar valve. This pushes blood into the aorta itself, and in this region the aorta is called, or forms, what's called the aortic arch. Notice the three immediate branches of the arch, and as you may know, this first one is called the brachiocephalic. It divides almost immediately into the right common carotid and the right subclavian. The next branch of the aortic arch goes up the neck on the left side. It's called the left common carotid. And then finally here, this branch, which bends over under the clavicle, it's called the left subclavian. These then are the three branches of the aortic arch. But before the arch itself, the aorta gives off branches, so-called coronary arteries, which supply blood to the heart muscle itself. There are two main coronary arteries. This one seen here runs over to the right side of the heart and is called the right coronary artery. The left coronary artery is typically obscured because it's under this vessel, the pulmonary artery. And so by the time we see it, right here, it's essentially preparing to divide into two vessels, one which runs diagonally down the front of the heart, and one which runs behind the heart, seen here. Let's reconstruct the anterior view of the heart. And now we can point out this vessel, which is a branch of the left main coronary artery. This is the left anterior interventricular coronary artery, which, as you can see, provides oxygen and nutrients to much of the left ventricle and part of the right ventricle. The left main coronary artery provides blood to both the left anterior interventricular coronary artery, supplying blood to the left ventricle and also parts of the right ventricle. But the other branch of the left main coronary artery courses around the back of the heart, and this is called the circumflex coronary artery. Returning to the anterior view, now on the surface we can see better this vessel, which branches from the aorta, and recall its name, the right coronary artery. And so we've made our tour to and through and from the heart, and we can move on now to more details. Before moving on to actual specimens, let's review some of the structures that we've seen. Externally, recall this is the right auricle. Over here then the left auricle. Here, taking blood to the lungs, is the pulmonary artery. Here from above, the superior vena cava. Coming in from below, the inferior vena cava. And of course, the aortic arch and its three branches. The notable coronary vessels include the coronary artery to the right side, aptly named the right coronary artery. Here, running somewhat diagonally down the front, is the left descending or left anterior interventricular coronary vessel. Coming around the back, the circumflex coronary artery. And these large veins returning blood from the lungs, these, remember, are the pulmonary veins returning blood to the interior of the left atrium. One final structure, which is very prominent on the posterior side, is this large vein, which empties also into the right atrium. This receives blood from the myocardium. It receives deoxygenated blood from all around the heart and collects it and returns it to the right atrium. This structure is called the coronary sinus, and at least in this model, it can be seen internally as it fills or empties blood into the right atrium. Before finishing, it's noteworthy to consider two fetal structures which allow blood to bypass the lungs during fetal life. Remember, in a fetus, the lungs are not filled with air and providing no oxygen to the blood. Thus, sending blood to the lungs is without purpose. Notice then on the interior of the atrium, there is this shallow fossa, which in fetal life was actually a hole or passage from the right atrium over to the left atrium. In fetal life, this is called the foraminal valley. But after birth, this closes and seals, and then it's represented only by this membrane-covered opening, which is called the fossa ovalis. The other means for blood to bypass the lungs in fetal life is a passage from the pulmonary artery directly to the aorta. This tubular connection in fetal life is called the ductus arteriosus, and it's shown as number 3 in the illustration on page 66. The ductus arteriosus. Within a day of birth, this closes and becomes the ligamentum arteriosum, in other words, closes in such a way that blood no longer can bypass the lungs and therefore travels exclusively to the lungs as it should. Let's now take a look at a porcine heart, better known as a pig heart. These are widely available and are very similar to the human heart, which is why we use them in lab. This is the anterior view, and many things catch our attention and resemble the model, as you recall. This external flap on the left side would be the left auricle. Here we see a vessel coming apparently from the right ventricle. This goes to the lungs, so that's the pulmonary artery. We notice this coronary vessel coursing diagonally down the anterior side, and this is the left anterior interventricular coronary artery. The yellowish fat we see is actually underneath a surface layer called the epicardium, also known as the visceral pericardium, and we'll see that later. This heart has been cut in a frontal section, so when we open it up, we immediately see the largest pumping chambers, the ventricles. How do we tell the left from right? Notice this chamber has a much thicker muscle mass. This muscle, incidentally, is called the myocardium. And this chamber is stronger accordingly. This then, the left ventricle. Over on this side then, the right ventricle. Why is the left ventricle so much stronger? Well, basically the left ventricle pumps blood to the entire body, which requires quite an effort. The right ventricle pumps only to the nearby lungs, and therefore less force, less effort is necessary. The structure here, which separates the right from left ventricle, is called the interventricular septum. It too is made of myocardium. Let's zoom in. Here we can see a glossy, smooth surface which makes contact with the myocardium. This is the inner endothelial membrane, which goes by the name endocardium. So, here, the endocardium, this, the myocardium, and the surface membrane known as the epicardium, also known as the visceral pericardium. Here, internally, we can see the sharp contrast between the myocardium and the slippery and glossy surface on the inside, which is known as the endocardium. The endocardium minimizes friction as blood moves through, and it also forms these valves, indeed all of the valves, whether AV or semilunar. In this specimen, as we zoom in, we can actually see and peel off that surface membrane which clings to the myocardium and is known either as the visceral pericardium or simply the epicardium. In this pig heart, we're now looking at the posterior surface. We see the epicardial fat and presume the surface layer here to be the visceral pericardium, also known as the epicardium. If we follow this along, we can see what is the cut edge of the parietal pericardium, which normally would cover this entire space and create a pericardial sac or pericardial cavity, which is filled with pericardial fluid. As you know, the pericardium is a serous membrane, and its function here is to minimize friction between the heart and the surrounding organs, especially the lungs and chest wall. Pulling back, we see more completely the left ventricle, and if we pull this part, we can see this chamber above, which provides blood to the left ventricle. Therefore, this would be the left atrium. And the valve, which is seen here quite well, is the mitral valve, also known as the bicuspid. And these cord-like extensions are called the chordae tendineae, which attach to the nipple-like projections of the myocardium, which are known as papillary muscles. Let's imagine and trace the movement of blood as it might first fill the left atrium. Blood would move down through this valve, which is the mitral valve, filling the left ventricle. Then, as this valve would close, blood would be directed in this path through a valve which is the gateway to the aorta, seen here, the aortic semilunar valve. Here's a closer look at the aortic semilunar valve. All heart valves are subject to disease or deformity, and the aortic valve is especially susceptible. In some cases, it becomes leaky or incompetent, allowing blood to regurgitate back into the left ventricle. More commonly, the aortic valve becomes stiff or stenotic, and this reduces blood flow from the left ventricle. In the past, aortic valve replacement required open chest and open heart surgery and many months of recuperation. An amazing and less invasive procedure today is available. It's called TAVR.
Transcatheter aortic valve replacement, or TAVR, is a less invasive catheter-based procedure. It is revolutionizing cardiac care and reducing the need for traditional open heart surgeries. It's a treatment for aortic valve stenosis. That's when the aortic valve in the heart functions poorly, usually due to calcification, reducing blood flow throughout the body. A typical TAVR involves inserting a guide wire into the femoral artery and threading it through the aorta, then around the aortic arch and into the stenotic aortic valve and left ventricle. A common TAVR procedure involves delivering a new valve with a balloon catheter over that guide wire and into the stenotic valve. The balloon is then inflated, opening up the old valve and putting the new valve in place. The wire and catheter are then removed, leaving behind a new, functioning aortic valve. Here you can see the new valve opening and closing and able to restore normal blood flow.
A recent beneficiary of TAVR is this person.
Finally tonight here, Start Me Up. Mick Jagger's back. This was the image right after Mick Jagger underwent medical treatment, reportedly for a heart valve issue, saying, "Thank you everyone for your messages of support. I'm feeling much better on the mend." Mick Jagger, famous for racing across the stage, it's been said, he performs the equivalent of 12 miles in a single performance. And tonight, the new video from Mick Jagger, out to prove he's back. 75 years young, singing and moving in that studio. The rock legend tweeting the video out today, just 6 weeks after his treatment. Tonight, Mick Jagger, perhaps signaling, "Start me up." Billboard has reported the Rolling Stones may now kick off their delayed tour as early as July. Whenever Mick Jagger returns, we'll be ready. 6 weeks after treatment, he moves better than the rest of us. I hope to see you right back here tomorrow. Until then, good night.
Turning our attention to the right side of the heart, we see the right ventricle, and the valve at this location would be the tricuspid valve. Using my finger, I can move against that valve and actually find way into this chamber, which is the right atrium. Coming into the right atrium from above, you'd expect a vessel here. This is the superior vena cava. Let's confirm that this vessel does indeed go to the right atrium. We'll pass a stick from above and verify its entrance here into the right atrium. The other vessel that is known to deliver blood to the right atrium is the inferior vena cava. And in humans, that vessel is in line with the superior vena cava, but not so in the pig. In the pig heart, the superior vena cava comes from above, but the inferior vena cava comes in more perpendicular to the superior vena cava. And that we can find by just passing a stick and discovering indeed that this must be the inferior vena cava. At the same time, if we pull this stick back, we can locate yet another structure which empties blood into the right atrium. And that you can see here, which is a large blood-filled sinus known as the coronary sinus. So in summary, there are three vessels that return blood to the right atrium: the superior vena cava, here the inferior vena cava, and finally, collecting blood from the cardiac veins, this is the coronary sinus. What about the pulmonary veins? We know that they return blood from the lungs, and we know they come to the left atrium. But as we look around the back side of the heart, nothing obvious is immediately clear. So the best way to locate the pulmonary veins is to approach it from the inside out. This is the left atrium, and with my finger I can probe around until my finger emerges. This is a rather large opening which represents the pulmonary veins entering at this location. Quite often, in the removal of these hearts, it's done rather hastily, and instead of clipping the 4 independent pulmonary veins, a large scissor cut is made, leaving us only with one opening, which represents the return path for the 4 pulmonary veins. Locating the aorta is not difficult. Here we have a black tube, and the aorta is huge. And to confirm that that is the aorta, we can open the heart and notice that this tube does in fact come from the left ventricle. So this is the pathway into the aorta, and as you can see, there are 2 prominent vessels which are branching from the aortic arch. This is in contrast to the human, where you know there are 3 arteries branching from the aortic arch. But in the pig there are only 2. The first is the brachiocephalic. Instead of bifurcating, this actually divides into 3, and so gives rise to the right subclavian, the right common carotid, and the left common carotid. That would make this the second and final branch of the aortic arch, which is the left subclavian. Other visible and notable structures, again, the pulmonary artery, here, the left auricle, and the left anterior interventricular coronary artery. The right coronary artery is very difficult to see on the surface because it's located underneath this fat, which is just beneath the epicardium. Therefore, to see the right coronary artery, we need to section the heart, as has been done, and zoom in enough to actually see this vessel surrounded as it is in fat. This then is the right coronary artery. The circumflex coronary artery, as you know, goes around the back side of the heart, and here it is seen again under the fat, which is the fat located beneath the epicardium or visceral pericardium. Coronary artery disease is the leading cause of death around the world. Every year, over 9 million people succumb to heart attacks. In the past, treatment of CAD involved transplanting a vessel from the leg and bypassing the occlusion on the coronary artery. Today, CAD is more often treated with PCI, Percutaneous Coronary Intervention.
Percutaneous coronary intervention, or PCI, is a procedure used to treat and evaluate partially and completely occluded coronary vessels. Atherosclerosis results from endothelial injury, inflammation, and accumulation of lipoprotein, leading to intimal deposition of particles and narrowing of the coronary artery. The stenotic vessel makes it difficult for red blood cells to pass through. Therefore, the risk of ischemia and infarction is increased. During a percutaneous coronary intervention, an incision is made to isolate the femoral artery. A catheter is inserted into the artery and guided up the aorta to the heart. Live angiography is used to guide the catheter to the obstructed coronary artery. Radiopaque dye is injected into the artery. Imaging determines the location of the stenosis and the diameter of the vessel. Once the vessel is isolated and the obstruction located, a guide wire is threaded through the catheter to the location. The catheter is removed, leaving the guide wire. A balloon catheter is pushed over the guide wire and centered over the blockage. The balloon is inflated to open the narrowed vessel. The balloon is inflated and deflated multiple times to gradually widen the occluded vessel. To ensure that the artery remains unobstructed, a second balloon catheter with a stent is threaded to the location. The balloon is inflated, expanding the stent. Flow through the coronary artery is restored.
Here's another pig heart. But let's go ahead and actually cut this heart transversely. And let's do so from the apex of the heart toward the base of the heart. So here we go. A slice transversely. And we see how thick and remarkably strong the myocardium is. Let's do this again. Now, for the first time, we can see the thin wall, which actually is part of the right ventricle. So this, the interior of the left ventricle, over here the right ventricle. And this wall, this thick band of myocardium is called the interventricular septum. Let's continue. Now we can see not only the chamber, but also the papillary muscle here on the right side. These are two papillary muscles which we assume are connected to chordae tendineae. Once again, the interventricular septum, quite noticeable. Continuing. The same as before. The chamber on the left side is quite easily seen. And now we can grab and actually pull out some of the chordae tendineae that must be attached to the mitral valve, since this is the left ventricle. Now again, we can see more of these chordae tendineae, and as before, the right ventricle versus the left ventricle. One final cut. This time, we reveal actually the aortic semilunar valve. And we can see its leaflets, which have no chordae tendineae. This would be the superior view of what would be the mitral valve, because this is the left atrium. This view is especially nice because as we zoom in, you can see the transition between the valve leaflet and the strong but delicate chordae tendineae, which then attach to and are acted on by papillary muscles. In this view, the papillary muscles are even more distinct as they project from the surface of the inner chamber. So, because this appears to be the left ventricle, this is a group of papillary muscles, chordae tendineae, and naturally then this being a portion of the mitral valve, also known as the bicuspid valve. Now this heart is huge, and it's not from a pig, but rather from a cow. Being a larger and heavier animal, the heart is correspondingly larger in size. We can see at once the left auricle. Over here, a glimpse of the right auricle, pulmonary artery, and the aorta, which is as large as a garden hose in this case. This is the first branch of the aorta, and so this would be the brachiocephalic artery. Inside, quite impressive, the very large, voluminous left ventricle. Here then must be the mitral valve. Above this space, the left atrium, and blood moving from the left atrium into the left ventricle would then be pushed out through this outlet into the aorta, and this is one of the three cusps of the aortic semilunar valve. Interventricular septum, right ventricle, and above, of course, we'd expect to find the right atrium. And now, finally, we have a specimen from a human being, a cadaver heart, and right away it resembles, of course, everything we've studied so far. Clearly, we can see the aortic arch, and in this species, naturally, 1, 2, 3 branches of that arch. This then, brachiocephalic. Second branch goes up the neck on the left side. It's called the left common carotid. And finally, this one, which courses over to the left shoulder, it's called the left subclavian. The aorta, huge as you can see, and it's been cut here at the base, which allows us the unique opportunity to actually look inside. And let's zoom in a bit to do just that. This gives us a superior view of the aortic semilunar valve. Notice that the cusps are 3 in number, although this cusp is a little weak. If we look right here, you might be able to see an orifice, an outlet, which is in fact the outlet for the left coronary artery, which is just distal to the aortic semilunar valve. All right, pulling back, we can identify this vessel, which is coming out of the right ventricle. It's the pulmonary artery. Over here, we see the left auricular appendage. And this cutaway reveals the left ventricle, a robust papillary muscle, and in this case, chordae tendineae which have been cut, although they normally naturally would be attached to the mitral valve. Let's cut away the other side to reveal the interior of the right ventricle. Once again, the chordae tendineae are visible, this time associated with the tricuspid valve, which directs blood flow from the right atrium to the right ventricle. Closing that and turning around to the back, we see this vessel, which is rather thin-walled and runs down apparently into what would be the right atrium. Here's the right atrium exposed internally. The inferior vena cava has been cut rather short, and so there's not much to see here except this opening, which would have been for the inferior vena cava. Looking directly posteriorly, we can see and open up the entry into the left atrium, and we can identify 2 inlets from the right side and 2 more from the left side. So now with this open, we can say this is the back side of the left atrium. And if we open this up and look from above, we can even see now the mitral valve. Here's a perfect view of the mitral valve seen from above. It resembles the appearance of a mitre,
leaflets.
which is a headdress worn by members of the Catholic Church. Again, on the posterior side, the only remarkable thing that's discernible is this blood-filled vessel here, which has been somewhat dislodged. But it does course over and empties its contents into the right atrium. As such, it's the coronary sinus, collecting all blood, all deoxygenated blood, from the cardiac veins. Before leaving this heart, let's go after the pulmonary semilunar valve, sometimes difficult to locate or see. This is the cut margin of the pulmonary artery. So, if we zoom in from above and open this up for inspection, there it is, the pulmonary semilunar valve, sometimes just called the pulmonary valve, with the name semilunar understood. Remember, the pulmonary and aortic semilunar valves are anatomically identical. That is, they don't have any chordae tendineae. They rely on closure of these flaps just through overlap and contact. And therefore, sometimes it's hard to tell a pulmonary semilunar from an aortic semilunar unless you have the reference of the vessel itself. Now here's our final heart, a cadaver heart from a male, quite a bit larger than the one we just saw, but many of the same structures are visible. The tags here were placed by students in the past. Right away, we see the anterior surface and the aortic arch in plain view. This membrane we haven't seen before is the parietal pericardium, which normally encloses the entire heart and is continuous with the visceral pericardium. This creates a pericardial space or sac, which is filled with fluid to lubricate and minimize friction. Here we get a look at the inside diameter of the aorta. And backing away, we see the brachiocephalic, left common carotid, and lastly, the left subclavian artery. Here's a glimpse of the pulmonary artery. And as we turn to the right side, we can reveal the interior of the right atrium. And inside, there's a foreign body here, which is a wire leading through the atrium, apparently into the right ventricle. This is a pacemaker electrode, which normally comes in from the superior vena cava, passes through the right atrium, and then goes through the tricuspid valve to stimulate the right ventricle. Let's take a moment to discuss the mechanical and electrical activity of the heart. The heart, as you know, has four chambers, the atria and the ventricles. When the atria contract, blood is forced through the AV valves into the ventricles and then out the semilunar valves into the outgoing arteries. Normally, when blood arrives into the atria, it does so from the superior vena cava and the pulmonary veins. The SA node fires, it causes the atria to contract, the ventricles fill with blood, and the electrical signal is picked up by the AV node, spread through the His bundle, into the Purkinje fibers. The ventricles then contract and push blood into the pulmonary and aortic valves. Sometimes the communication between the SA and AV node is lost. And so the ventricles have to be stimulated with an implantable device known as a pacemaker. The electrode leads are fed through the subclavian vein, through and into the ventricle, stimulating it on a regular basis. Inside the right atrium, we can see a structure we haven't seen well before. It's the fossa ovalis, a depression seen here, which used to be an opening in fetal life, allowing the blood to flow directly from the right atrium to the left atrium, and therefore bypassing pulmonary circulation. In fetal life, it's called the foramen ovale. As we finish our tour of this human heart, let's turn it around and examine the posterior side to show nicely the arrival of the pulmonary veins from the right and from the left. Two arrive from the left lung and two arrive from the right lung. They fill the interior of the left atrium, and then, of course, blood is moved into the left ventricle. It might be curious as to why these are called pulmonary veins when they carry oxygenated blood. But remember, the definition of a vein is simply a vessel that returns blood to the heart. Now, as promised, here are the answers to the labeled structures seen on page 65 and 66. Naturally, you can stop the video at any time to check your answers before you finish.